male patients, hot topic. We've had lots of people ask questions about it. I think it is a tricky topic because I'm sure it's the same where you are, but we're heavily female dominated. It's still, I think internationally, about 90% female, 10% male, which means when you first start out in aesthetics, you're 100% female, and then you gradually start to get men in the in-between phase, and it's a little bit daunting for many people because they are different. And it's worth being clear that I'm picturing I'm picturing very masculine heterosexual men who are kind of like, or if you want to create a stereotype, we would call them blokes, like straightforward, no nonsense blokes, because I think that's probably the rarest type who come and see us, and they are different. And it took me a while to figure it out. So I'd be grateful. And obviously we are men ourselves, so we've got those insights, but it would be good to share with our largely female audience, actually, and hopefully we can make it better for them when they first see a patient. So have you noticed a difference with how they present to you?
Yeah, they're a little bit more straightforward. They know exactly what they want, and if they're coming in, it's for something specific. And they also, I mean, everyone loves attention to detail, but whenever I'm dealing with men, I'm really taking out a lot of my measurement tools, and these actually really help me. They really appreciate it, and that's something that they extremely feel comforted with. So for me, I do, we do detailed analysis of the face, but with these instruments, I'm giving them a lot of reassurance prior to ensure that I'm not going to overinflate them. They're not going to look puffy, and they're not going to look feminized. And I take my time with them, giving them certain measurements to ensure and make sure that they understand what's going to happen. I will not start until they have a full, clear idea of what our plan is. And I find that men, like you said, blokes are just, men who want to stay looking masculine, they really appreciate that.
One of the most common questions we seem to get is the difference in toxin doses between men and women. What do you find the difference is? Let's break it down by area with glabella, forehead, crow's feet, and...
So forehead, absolutely. Almost, let's say the upper face, probably 1.5 times usually what you're going to use. And it's usually because the muscles are stronger, right? So I just basically, have them raise their eyebrows. And if you can tell those are thick muscles and they have, 6 bumps there, you're going to need a lot of toxin. And for me especially, I don't have that thick of a muscle, but I use a lot of expression. I need a lot of toxin. I need at least 20 units of just my frontalis in order to help calm it down, and I'm due soon there. But you can tell even with that, there's enough movement. I don't have a strong glabella, which is unusual for a man. Most men who come see me, they usually need 30 units, and I'm always hesitant placing that much because I'm afraid that it's going to spread. So I usually have to do it in 2 tries. And then for the crows, depends. For myself, I need a lot. I probably need, I have a little bit of an eyelid that tends to droop a little bit, so I tend to do the tail. So let's say if I'm including the tail, I'll need a good 20 units per side.
Mm-hmm. So doses. Next, let's work our way down the face in terms of how you approach forehead, cheek, chin, and jawline. I would imagine my impression of men is that they are more focused, and it's harder to be more holistic. So, as in, they're quite set if they want a problem solved, and even with a great consultation, there's a smaller percentage who'll end up having a full face, but they do. What's your experience with foreheads? Is that something that people are receptive to?
Well, with foreheads, actually, one thing that men are starting to see me a little bit more for is that indentation that's here in the forehead. And I can fill that with a cannula. I've recently switched a cannula. It is a higher risk place to inject, and we go through all the risks. But it does make a difference if you're seeing someone who's confident and knowledgeable of treating that area. It does a nice job smoothing that out. That frontal bossing that some people end up having, or the right above the corrugators, sometimes there's that bone that's a little bit more projected. And I've had clients come and see me, and they said, I went to this one guy, and I'm never going there again because he scared me. He had these big bones coming out of his head, and I started noticing I had it. I'm like, well, that's the first thing I'm doing. So I filled that up right away. But it's weird, right? It's all these little things that women also get it, but in the forehead, that's something that can also help. Whenever I treat that, it helps those stubborn lower lines.
Yeah. Oh yeah, so it's a good way of getting lines that you might cause a drop with toxin.
Mhm.
Um, the inverse of that though is that's quite a masculine feature. So if you can in theory overdo it and hide the brow and slightly feminize someone, so that's just an interesting thing to think about. But I know, like everything, we're always trying to get that balance of soften it, harmonize it, but don't remove it completely. I'm going to be one of those who needs. I haven't done anything yet, but this is great flattering light. You can't see it, but I have exactly what you're talking about. But yeah, not bothering me too much yet. But it's one of those areas that you notice and start to think about. So you talked about eyes as well. I mean, let's switch actually to the other thing, which because I think I saw in one of your videos an interesting idea about actually projecting the periorbital ridge and making that more dominant. Tell us a bit about that.
So with here, a lot of times, whenever we're doing the eyebrow, the tail of the eyebrow tends to flatten out. You lose a little bit of volume here. Sometimes men will have a pretty strong bony prominence, and then that either goes away or it just opens up. And as a result, the eyebrow tends to just kind of like involute or fall in. So what I'll try and do is I ask them to usually bring in a picture of when they were younger. And it just kind of gives me an idea of what that eyebrow looks like. If they don't have it, I'll work with it. But if they do, then I'm trying to imagine. Basically, most of the time, whenever they bring it in, there's more projection here. They usually have a little bit more fat pad, or it's a bone, I'm not sure. It's likely a fat pad. But therefore, I'm confident to recreate that. And even with the recreation, if it's a little bit projected, I can fan some product behind it to make a smooth transition out. And they love it. And it does a great job. And to be honest, the best outcome that I get, if someone's really on board for having this treatment and maintaining it, I actually do 6 units of toxin to each lateral eyebrow 2 weeks prior. I have them come back so it's in its most up natural position, and then I'll go ahead and do the filler, and I'll just encourage them, say, by the way, you need to upkeep this, see me every 3 months, and we'll touch that up, and it looks great.
Is the bulk of that product, are you kind of underneath the whole eyebrow, or are you mainly focused on the lateral kind of third or lateral half?
That's a great question. I actually have a sister clinic in Toronto, and in Toronto, most of my clients there are Asian, and they see me for this all the time. They want basically more protrusion right from the tip of the medial eyebrow all the way lateral. So I'll go with a cannula, and because if you understand that the notch, it's a scary place to be for a lot of people whenever they first start. You do have to be knowledgeable, but that notch there is really deep. So as long as you're kind of staying, rather superficial, you don't have to be too superficial, but you're going with a cannula and continuously making that motion, you can get a really nice result here. And yeah, Asian population, they really want it all the way from the front to the back. With Caucasian population and also black men who come to see me, I usually end up treating from the mid-brow laterally, not forward.
So next, so we've done. Let's talk about cheeks then. Next, what do you think about? Do you have men asking for cheeks? Like, can I have fuller cheeks, or is it how do they present in that area? Consultation driven.
So it's pretty rare for a guy to come to see me and ask for cheeks. But whenever I'm doing the evaluation, whenever I come down to the cheek, I just look at where's the apex, where should it be, is there loss of volume there, and then I automatically always, I'm drawn immediately because I almost always see some loss of volume here. And I know right away if I just end up placing some volume into the mid-cheek and I tie it to the apex, it's not only going to just keep them looking refreshed, but they're going to look like they're 5 years younger in 20 minutes. It definitely wakes them up. It'll look like they just went on vacation. And it's something that and that's, again, the importance of doing a full face evaluation, because whenever men come to see me, they're like, what do you think? If I just look at them quickly, I say, oh, you look great. I don't think you really need anything. When you're doing the detailed evaluation, like, oh, if I really want to be picky, we can do a little drop here. And it's not going to make that much a difference, but it's going to save you maybe a year or two from now, and you'll appreciate it then, and no one will really notice. So these little details in the mid-cheek are something that I would recommend when I'm doing that full face assessment. And it's usually me that brings it up, and we do it very conservatively. The only time that I've had a guy come to see me, I've had one guy come to see me for his mid-cheek, but he was extremely fit. He was very fit. This guy trained 7 days a week. probably 5 to 7% body fat, and he just had very sunken mid cheeks here, and he just said, I was wondering if you can fix that without me looking like a chipmunk. And absolutely we did. Take a conservative, use a 3mm approach rule, use a cannula, and it looks fantastic.
So what I picked up from one of your videos as well is that this male cheek is much more about anterior projection rather than lateral projection.
Yeah, absolutely. So this tool here, this is my Golden Means caliper, and some people think it's fluff. To be honest, it keeps me in check. Clients love it because it ensures them that whenever I'm done, I'm doing multiple measurements, and they're never going to be overfilled. And reassuring a client with that is just kind of a breath of fresh air for them. And I mark out exactly the difference between the apex of a cheek for someone who wants to have a feminized cheek versus masculine. Feminized is going to be more lateral, tail of the eyebrow, drop it, upper ala of the nose to the upper tragus, and it's here. Use this to kind of, measure it. But men's are going to be more medial. Like even if you're looking at my apex of the cheek, it's right here, right? It's not up here. So the way I do that is I just basically take a line from the lateral portion of the mouth to the lower tragus. Then I take a little triangle from the lateral aspect of the pupil, and then after that I connect the triangle and I bisect it. Once I bisect it, I go up to about the 1/3 aspect, and I use my Golden Means ratio to confirm it there, and I will be around. So this is kind of a slight misconception that I want people to know. Whenever I'm making these measurements, let's say if my apex was around here. Well, my apex isn't here. My apex is actually right here. So that means I have to look at the natural anatomy of the client, and I want to respect that. I don't want to drop his cheek all the way down here because that filler is not going to stay there, and it's just going to, look funny eventually. It may look good right now, but I still want it to look good 6 months, 9 months from now. So I respect the natural anatomy. If my apex gives me a point right here, but I know that the hover or the maximum point of the reflex of that bone is right here, I'm just going to move it up a little bit, and that's where I'm going to be. So these ideas are generalizations of more guidance towards where I think this should be. I use my aesthetic eye and at the same time reference points. And I know for absolutely I'm going to stay anterior. And I know a lot of people end up doing the cheekbone laterally as well for men. I don't. I find that I keep it more medial. And the only time that I'm doing any projection for the face is going to be down here if I feel they've lost master projection, but I don't ever usually do any cheekbone laterally for men.
So cheeks, what about lips? So another very popular question was, what do you do with male lips without feminizing? What's your approach to it sounds more like restoration, but it could be augmentation, but without making a feminine lip?
So whenever I'm doing men, if I want to keep them looking masculine, the only difference that I do is I try and kind of almost make it look a little more square, which sounds odd, but the lower lip especially, whenever you're doing the pillows, I try and keep my pillows closer for whenever I'm doing a feminine lip. And if I want to masculinize, I'm not going to have heavy pillows, first of all. They're going to be a little flatter and they'll be a little wider. So again, it's just kind of a little wider than a feminine lip. And I guess if you want to kind of, picture that, I'm going to come up close here. And basically, right here, this is ideally where if I was going to use a needle, I'd make my entrance point a little closer. And if I was going to do the entrance point with a masculine lip, I'd go a little wider. And if I did that, if I went a little wider with, let's say, a feminine client, I've yet to have anyone complain about it, but I don't personally like it. I find it makes the lip a little bit more masculine because it kind of squares it off. More recently now, I'm doing almost all my lips with cannulas these days, and it works great. The only thing that I try and do whenever I'm looking for a more masculine lip is hydration. I don't really change much. It's just more hydration. I'm definitely not arching any Cupid's bow. I just want to keep it natural, keep it hydrated, and that's about it. If there is a guy who comes in and they're looking for something more than that, then clearly it's because they want to have more feminine, more dramatic lips. But for a more masculine lip, keep it, natural, and you're just trying to rehydrate the lip more than anything.
Yeah, I totally agree. Basically, less is more. I do think there's something I sometimes think about, or at least explain, how the lip should fit in with the chin. So you can see it on mine, it's straight at the bottom and straight at the top. And then those angles, they sometimes meet. You can, it's what you're saying about it being wider. So it's because your chin is wider, and they kind of work better together. And it's also why, if you do it to a female, what you're picking up with your aesthetic eye is it no longer fits the face if those angles are now, if you follow the filtrum down, they're pointing somewhere over here instead of to the angle of the chin. It actually all fits really, really nicely together. Obviously, people don't always fit the ratios perfectly, but that's what you're aiming for. And that's why I think it makes perfect sense that wider lower lip and not making too much height. But once again, most men who are asking for lip treatments, not most, but you should consider that they actually want some feminization, and then it's a lot closer to what you might do with a female, but you're still respecting their existing proportions.
That's right.
So I think we agree on that. So I think a lot of what confuses people with male and female treatments is actually where you don't actually treat that heavily. So lips and cheeks, you don't actually treat them as heavily. You're not trying to create all those shapes. So it's actually easier once you give up trying to impose a female style treatment onto a masculine face. But that's not the case with chin and jawline, because that's really, I sometimes think of them as the cheeks of what they are for men, what cheeks are for women in terms of male beauty. So tell us a bit about your approach to this. This sounds like, from what you said, one of the main things that your clients are asking for, masculinization of the chin, jawline.
Yeah, I mean, there's a protractor that I use, again, and the protractor, whenever it's tough to do it myself here, but basically what I do is I place this on the jawline, and this idea just lets me know that you can drop really a jawline for men pretty low. You can almost go 90 degrees and it's still going to look good. So you've got a lot of play here. So let's say if someone has a very acute angled jaw and I want to drop that, you can drop that. I would be careful with how much filler you're using and the type of filler. If you're going to be using a lot of HA and you're going to be placing, like, I don't know, 6 syringes here, you got to be careful, because potentially in a year or two from now it's going to look like a big water bag. Filler here can help, but I'm switching over to a lot more Radiesse when I'm doing the jawline here, and also with a blend of, not blending it together, but I'll go in separately with Radiesse, and then after that I'll go in with maybe a stiff HA. And what that'll do is give me the best of both worlds. I'm not worried too much of having a water bag approach. I can still get that sharp definition, and at the same time, I can get the projection I need, and I can still mold it. So it's a really nice way for me to recreate a jawline. I also don't need as much filler whenever I'm using Radiesse. So, but again, it's something that I think a little bit more advanced clinicians might want to start using, because it's not really reversible. In theory, you can kind of like flood it with a bunch of saline, but still it's going to be there. So you just want to make sure that you've got a few, like, a consistent amount of jaw lines in your pocket where you feel confident that you can do that, and then you can go ahead and use it. The difference for the jawline here, whenever I'm doing, let's say, masculine jawline and a feminine jawline, is the feminine jawline, I don't want the projection. I will place that filler where the gonial angle is, behind and below, and I'm going to hug it to try and make sure it stays around here to catch usually a small jowl that's here. Where with a masculine jawline, what I'm trying to do is I'm looking at the zygoma, and I want that jawline to reach that zygoma if I can. A lot of times when men have a little bit weaker chin, I'll just take a straight angle and straight edge, and I'll say, hey, by the way, this is where, ideally the projection should be. If we want, we can, get as close as we need. Sometimes we're going to need a little bit more filler, but it gives them realistic expectations. Now, remember, whenever I'm doing the jawline, I'm not only doing the bone itself, the mandible and itself in the gonial angle, I'm actually fanning the product on top of the masseter muscle in order to give the illusion that they have a stronger masseter, because when you work out, when you go to the gym, that kind of like athletic look is a stronger masseter here. So I'm also encouraging that fanning of the product, and it ties it in really nicely.
Yeah, that's a really good tip around the jawline, because I think it's one of those things that the rookie mistake, which is, the injection techniques, but you get the aesthetics right from looking from one angle on the bed, and as soon as you see the before and afters, you see it's wider over here, and it's something you don't. Once you spot it, you get very, very careful about not doing the same again with female patients. So now let's move on to chins. What do you tend to treat them in isolation, or you're usually part of a full face package, and how would you approach them?
Yeah, chins are always interesting, right? Because you got to feel their chin. Sometimes you're gonna get a chin that's really stiff, like the muscle is almost, there's not much there. It's like right next to the bone. It doesn't move much, and there's gonna be a lot of resistance whenever you place your filler here. So, and when they're talking, usually when that happens, I notice that there's a lot of dimpling going on. So if that's the case, I know they've got a very strong and active chin, and I'll tell them, listen, we need to do your chin as well. But I have a feeling if I end up placing filler here, it's just going to flatten right out, and you're going to hate it. It's going to be really sore because that muscle's been fighting it. So I tend to place some toxin there first. Again, something that I do like with the tail of the eyebrow. Say, listen, come back in a couple weeks. We'll place toxin. It'll relax it. And then I'll be able to have more play with less filler, and then I can massage and mold what I need to. Cannula is...
That's a really good tip. Because I just, the other day I did a live show, and for whatever reason, the model had quite a lot of tone there, and it was really different injecting, and obviously I was on stage already. But if I'd assessed her before, for that particular thing, it might have made it a lot easier. So that's a really good tip. I've learned something. Because it would have been easier to sculpt it, because then you're only controlling one variable instead of trying to fight the muscle.
That's right. And I've had clients that come to me and they said, listen, I have my chin done in another place and it's still really flat. They just put it right in the middle. And I'm looking at their chin, and you can tell, like, this chin is going to fight this filler. So that's a great way to do it. Now, the technique that I use, for the most part, for the chin, I still use a needle. I mean, I'd like the cannula. If someone comes in and they have a really nice, loose chin, and I think that I can get some projection easily with cannula, I'm going to use a cannula. But whenever I'm really looking to either make a chin a little bit more narrow or wider, and I'm trying to kind of have a little bit more precision, needle for the chin is a little bit better for me. But again, we're talking masculinization right here, right? So if I wanted to really, even if I placed a bolus of filler into each pocket right here, and it ended up kind of just going back with the least passive resistance because of the cannula, it's not going to make that much of a difference. And to be honest, it's going to look just as nice. So I'm 50-50 basically. What I'm trying to say is that whenever I'm doing the chin, if I'm going to be using a needle or a cannula, but that chin scares me with that the mental artery that comes up here. I don't know the depth. Sometimes it's deep, sometimes it's superficial. And I saw that, I think you have the Clarius ultrasound machine. I have one here, and definitely anytime I'm doing the chin, if I feel like I need a needle approach, I'm taking out that ultrasound.
Yeah, no, it's one of those. Since having it, there are more times when in the past I would have just injected, and now I'm giving it a scan because we've done a couple of videos on it. I know Miranda's got her artery is right where it's not supposed to be. Although apparently a third, I saw someone, I can't remember who it was on social media, saying a third of their patients had an artery there. So it is one of those things. Once you can see, you don't want to not be able to see. So I think we'll have more of those scanners.
So, yeah, to top it off again, like, remember, whenever I'm looking at the chin, for me, I'm just looking at the mouth, the width of the mouth, which is usually, if you're doing the intercanthal distance of the eye, that's your 1. And then the width of the mouth is usually 1.618, and that's my measurement. Like, I'll actually put 2 lines right here. I'll put a line in the midpoint, and I want to make sure whenever I'm doing my boluses, they're going to stay in each of those pockets. And that's how I stay precise whenever I'm doing a masculine chin, for anyone out there who wants to know.
Thank you. That was, you really had fantastic holistic interview. We've covered so much. I don't think...
It's great. It's been over now. It's been an hour and 10 minutes. This is amazing.
Yeah. And yeah, great. Hundreds of people staying on. So I highly recommend. Where else? Anywhere else we should keep monitoring you for content? Obviously, you've got your YouTube channel, Instagram. That probably covers it for most of us.
YouTube, Instagram are the 2 main places. I am on Facebook as well, but really those are the 2 platforms that I use the most. And I appreciate everyone who's been here, and I appreciate you, Dr. Tim, or Tim, I should say. And this has been amazing.
Okay, well, it's been a pleasure. Really, really good talking to you, and I'm sure we'll do it again sometime on some of the topic. I thought maybe we could do some stuff on YouTube because it's easier to share images, and then we can put them on Instagram as well, which is what we normally do. But we'll see where the wind takes us. But it's been a pleasure talking to you, and thank you for all the stuff you put out, so that I actually know who you are, which is obviously the key for most people, and keep sharing and keep teaching, and hopefully see you
Likewise.
in reality one day.
And if I'm ever in a
Okay.
conference down there, then I'll stop by and say hi.
Absolutely, that'd be great.
Okay, take care.
Thank you very much, Dan. Bye bye. Good night.
Yeah.